Good morning, everyone, and welcome to the AMVETS Alternative Healthcare Summit. This panel is understanding the ECS and the medical benefits of cannabis. The ECS is the endocannabinoid system. Today, I'm being joined by a team of amazing physicians from this space who are here to offer their expertise on today's subject. Today, I'm joined by Dr. Paloma Lehfeldt, Dr. Rachel Knox, and Dr. Peter Grinspoon. I'd like to introduce them and give them a moment to say who they are. So, Dr. Paloma, would you like to go first and let everyone know who you are and what you do in this space?
Thank you, Stanley, and thank you, Teresa, so much for organizing this amazing event. I am thrilled to be on a panel with Dr. Knox and Dr. Grinspoon. I am a physician by training with a background in neuroscience research. Just means I accumulated a lot of student loans along my journey into the medical cannabis sphere. I love cannabis. I wrote my honors undergraduate thesis on THC, much to my professor's chagrin, and have always supplemented my education with cannabis. We aren't taught about cannabis in medical school, which I'm sure we'll discuss a lot throughout today. And I'm currently the director of medical education at Healtg, which is a physician-led cannabis company. We are focused on bringing research back into cannabis and bringing cannabis back into every single physician's toolkit so that we can better serve our veteran community. Thank you, Stanley. Looking forward to today.
Thank you so much. Next, we have Dr. Peter Grinspoon.
Hi, I'm Dr. Peter Grinspoon. I'm a primary care doctor at an inner city clinic in Boston, and I teach medicine at Harvard Medical School. I'm delighted to be on this wonderful panel. Thank you so much for inviting me. In brief, I've been involved in the medical cannabis issue my entire life for two reasons. One, my dad was a very famous activist for medical cannabis. He wrote a book called Marijuana Reconsidered in 1971, demanding that cannabis be legalized, which was pretty brave considering that only 12% of Americans supported legalization in 1971. He got a lot of crap for it, but also a lot of people sort of agreed with him, and he really started the discussion. So my childhood home was like one big cloud of marijuana smoke with people in the living room smoking and debating. So I've literally been involved with this issue my entire life. But the other thing is that my brother Danny fought an unsuccessful battle with leukemia when I was 8 years old, and he used medical cannabis. My parents got it for him illegally, during the early years of Nixon's war on drugs. And it was really the only thing that enabled him to hold down food the last year of his life. And I sort of saw firsthand how transformative medical cannabis can be. It really allowed him to live and actually to die with dignity. So as I entered medical school and completed my medical training, I was sort of immune to all the nonsense they teach us in medical school. And I've been in favor of it and really practicing medical cannabis my entire medical career, starting about 2 minutes into medical school. So I'm a huge believer and a huge advocate. And I'm just totally excited to be part of this panel, and a huge believer in the rights of veterans and everybody to have access to safe and legal supply of medical cannabis.
Thank you so much, Dr. Grinspoon. That's some amazing insight. And finally, we have Dr. Rachel Knox.
Hi, everyone. A pleasure to be here, spending time with this illustrious panel, but also presenting to all of you. I'm Dr. Rachel. I typically go by Dr. first name because I have 3 other doctors in my family who combined make up Dr. Knox. In 2016, we founded our American Cannabinoid clinics, where we practice integrative and functional cannabinoid medicine. So my background's in family and integrative medicine, and but these days I don't call myself that. These days, my colleagues call ourselves endocannabinologists because we're doctors of human beings who have endocannabinoid systems, and we practice cannabinoid medicine, which is the clinical application of the pharmacology of cannabis in clinical practice. And we started these clinics because At the time, all of us are familiar with the quintessential cannabis clinic, pot doc situation, if you will, where patients come in to get evaluated for medical authorizations, and they might spend 5-10 minutes with the doctor, no different than what happens in the conventional setting. And while legacy patients don't need a whole lot of handholding, it is now 2021, people, and everybody is considering cannabis as medicine. And many new patients need doctors who understand the pharmacology of the plant and the physiology of the body that the plant works on, so that they can have good outcomes, right? It's really hard to traverse this cannabis landscape this day. This market is wild. So we wanted to offer comprehensive care in that area. So we very much do believe we're pioneering the new field of endocannabinology and cannabinoid medicine. We believe we'll have endocannabinologists board certified in the future. Our hope is for endocannabinology to be taught in medical school at the least, which I know we're going to get into that as well. But other than that, I wear a lot of policy and regulatory hats. I'm the immediate past chair of the Oregon Cannabis Commission. So I chaired our commission, and in that role, I advised our Liquor Control Commission and our health authority on all things medical use of cannabis. So I will leave it at that so that we can dive into the good stuff.
Thank you so much, Dr. Rachel. Sounds like you have a family of caregivers and educators. So ladies and gentlemen, that was our amazing panel. As you see, you have a team of experts here today to help you traverse the endocannabinoid system and cannabis's healthcare. I didn't tell you enough about myself as your moderator. Again, my name is Stanley Atkins II, and in the cannabis industry, I'm known as the Cannamedic. I'm a retired firefighter paramedic, and upon becoming ill a few years ago, I learned that there was a lack of education on the access to medicines, the different therapies, and I began to educate myself so I could educate my community and my politicians. I am a United States Navy veteran. I served 2 deployments in Operation Iraqi Freedom, Operation Enduring Freedom. And so today, ladies and gentlemen, this is 4 veterans being moderated by a veteran. And with that being said, let's get into it, ladies and gentlemen. So this panel is understanding the ECS, which is the endocannabinoid system, and the medical benefits of cannabis. So I'm going to start with you, Dr. Paloma. What is the ECS in a brief description? We're going to go through everyone. Give us a brief description to a veteran, maybe just returning home, who's never heard of it. What is the ECS and how does it work?
Sure. I love the ECS. I'm sure my co-panelists do as well. And it's arguably one of the most important organ systems in the human and mammalian body. It literally interacts with all of our other organ systems to maintain homeostasis, which is just a fancy way of saying balance. Kind of if your air conditioner isn't working in the summer, there's this lack of balance. You're incredibly hot, you're sweaty, and the ECS kind of serves as that electrician to come and fix that AC and really restore that temperature in your body. In the same way, the ECS works throughout all of our organ systems and maintains that balance throughout. So it's incredibly important for a lot of these conditions that disproportionately affect our veterans, most notably chronic pain, PTSD, and other mental health disorders. So I'm incredibly grateful to be speaking about this today.
Thank you. Thank you. Dr. Grinspoon, would you like to give your brief description on what is the ECS and how does it work?
Well, I just want to add a little bit to what Dr. Paloma said. The ECS stands for the endocannabinoid system. And, cannabis is a plant medicine, but the endocannabinoid system is really the neurotransmitter system, the system of sort of receptors in our brains and neurotransmitters by which cannabis works in our brains and our bodies to work its medicinal effect. And just what's interesting in it is that for the longest time, we didn't know how cannabis really worked in our brains and our bodies. Most people have heard of endorphins, the sort of natural opiates that we make when we're in pain. And a lot of the research on cannabis has been suppressed by the US government. They really focused on harms instead of benefits, which is related to the fact that the VA hospitals, the doctors aren't allowed to even discuss cannabis with the patients. There's been this huge bias against cannabis by the US government. So the research has really been delayed. But much more recently, just within the last like 3 or 4 decades, we've learned that this whole natural system in our body called the ECS, which stands for the endocannabinoid system, which is natural system of receptors in our brains and neurotransmitters that work to do exactly what Dr. Paloma says, to keep our bodies within balance. And we're just starting to understand how cannabis, a natural plant-based medicine that in a lot of ways is, much safer than a lot of the medications that doctors dump on us, works through our brains. So the endocannabinoid system is just the system that we have naturally to regulate a lot of our natural bodily systems, but it's also the system by which cannabis and other cannabis-based medicines like CBD is a lot of, a medicine or a supplement that a lot of people use. It's just this system by which these medicines work. So that's why we're all excited about it, because we're just understanding how cannabis and these other medications work. So that's why we're putting all this effort and excitement into the ECS.
Thank you so much. Dr. Rachel, so what would you say? I'm a veteran. I've never heard of the ECS. I missed the 2 previous doctors. Dr. Knox, how would you say, what is the ECS and how does it work?
Okay, well, the endocannabinoid system, or ECS for short, is the master regulatory system in our bodies. So I do like to call it the most important system in the mammalian body, because its role is to keep our bodies in balance. If we're too inflamed, it's supposed to, relieve us from inflammation. If we have pain, it's supposed to quell it. If we're tired, it makes us rest. If we need to forget things, well, it helps and aids in forgetting. What's interesting, right, is that scientists date this system to approximately 400 to 600 million years old, right? Common to all animals except for the insect. What's interesting is that cannabis didn't show up on this earth until 20 million years ago. So this system that's made up of receptors and ligands that are locks to those receptors to unlock a door and downstream effects, those are our cannabinoids, are what make up the system. And guess when it was discovered? Between the years of 1988 and 1995. That's 30 years ago. So it's been 30 years that researchers have known about this system that is constantly responding and adapting to external and internal stimuli 100% of the time, fighting to keep our bodies healthy and in balance. It is wild that it's been 30 years since this amazing discovery, and this is still not being taught in medical schools. It is still not required for physicians, health or medical professionals across the board to know this information. And that's really a shame, because science is revealing more and more about the system every day, including that we have diseases of endocannabinoid system dysfunction, right? We can have endocannabinoid system hyperactivity, diseases like cancer and diabetes and rheumatic diseases are what constitute an ECS excess. And then we have classical diseases of endocannabinoid deficiency, PTSD, migraine headaches, fibromyalgia, IBS, right? Autism spectrum disorder, we're finding out is associated or correlated with deficiencies in endogenous cannabinoids. Cannabinoids our own bodies make. So with this information, you would think, right? You would think that doctors and medical institutions would be clamoring to get this information out to the masses. But unfortunately, this endocannabinoid system does one thing. It validates cannabis as medicine. It explains why cannabis works. It explains why cannabis is appropriate for clinical application. And honestly, I think that's too big of a pill for many of our institutions to swallow, this being what the 50th anniversary of Nixon's declaration of war against drugs, but what we actually know to be war against people and a plant.
Thank you so much. So for the veterans and the family members and even the caregivers who are going to be watching this video, I want you to know that these physicians have given you a great wealth of information. So in the gist of that, everyone has an endocannabinoid system. So even if you're enlisted or you're no longer enlisted, you've never been a veteran, you have an endocannabinoid system and it regulates your body. Thank you so much. Dr. Rachel, your last comment led into my next question is, what is medical cannabis? In the military, that is something that is taboo. It is something that is not discussed, and it is a no-go zone. So if you could, we're going to go into the other physicians as well. What is a brief description of medical cannabis, given that many veterans have limited experience?
Well, what we mean by medical cannabis in actuality is the medical use of cannabis, right? There's no such thing as medical cannabis or recreational cannabis. Cannabis is cannabis, right? It's a species of plant that comes in multiple, right, endless chemical varieties that we can use for all sorts of things across industry and agriculture and nutrition and, yes, medicine. So cannabis has tons of phytochemicals in it, like cannabinoids, also terpenes that are pharmacologically active, right? And so anybody can reach for this plant and consume it for all sorts of reasons, right? For recreational ones, for spiritual ones, right? Cannabis is considered an entheogen. It has historically been used in religious ceremony. People can use it for wellness purposes, therapeutic purposes, and yes, even medical purposes. So the medical use of cannabis is the consumption of cannabis specifically to treat a medical condition.
Thank you so much for that. Dr. Paloma, what are some of the things that you would say, hey, I don't know what medical cannabis is. Could you tell me what is medical cannabis?
Sure. Let's go back to 2800 BC, which is really when we first see the first documented use of medical cannabis. And like Dr. Rachel said, cannabis is cannabis. We don't need this adjective making it medical. Everyone is treating something, whether or not you're using it for insomnia or a mental health condition. There is no other, pharmaceutical out there approved by the FDA that's able to treat all of the different things that cannabis is able to treat, and that's because it's a plant of over 1,001 molecules. It can treat mental health ailments, it can treat chronic pain, and it's been around for so much longer than we're really aware. 1850s, United States, it was in the United States Pharmacopoeia, which is basically the Bible for prescribing different medications. A tincture of cannabis was in 50% of United States citizens' homes, and the only reason it is no longer there is because of the so-called war of drugs. It's incredibly important, and we'd be remiss if we didn't talk about the reason why cannabis is no longer available to our veterans and available to people who really, really would benefit from it. When we talk about side effects of other medications and compare it to cannabis, which is not a panacea by any means, it's incredibly benign. Cannabis, as it acts on our endocannabinoid system, is much gentler. It doesn't bind as tightly to our receptors, and it's really able to aid in so many different multifactorial conditions because it is a multifactorial plant. And so, again, really going back and understanding why we aren't taught about it in our schools, why it's so important to treat our veteran community is incredibly imperative. And we're so behind other countries at this point with how they're using medical cannabis.
Thank you so much for that. Dr. Peter Grinspoon, I have a question for you. So I know that there are a lot of stigmas behind cannabis and healthcare, but what are some of the stigmas that surround healthcare and cannabis, and how can we educate VA physicians on the expansion of medical cannabis when treating veterans?
Well, as Dr. Rachel and Dr. Paloma have mentioned, cannabis used to be legal. First of all, there's nothing new about medical cannabis. It's been used by humans for 5,000 plus years. And it used to be a legal, popular medicine in the United States until it was made illegal in the 1930s. And when it was made illegal, it wasn't for health purposes. The American Medical Association was the most vocal voice against making it illegal. It was made illegal because of racism and competing commercial interests, not because of medical concerns. And the stigma that we have was deliberately manufactured by the US government, as Dr. Rachel alluded to, as part of Richard Nixon's war on drugs. So we're dismantling a stigma that was deliberately created, the Partnership for a Drug-Free America, this is your brain on drugs. So we're sort of dismantling something that was deliberately created. It didn't happen like incidentally. And, it's really unfortunate. I see these elderly people that want to try cannabis, for example, for chronic pain, because they don't want to wreck their kidneys with non-steroidals or, be on opiates that are going to make them drugged out or constipated or whatever. And, they come in and they whisper and they make sure the shades are drawn and they're like, can I try some medical cannabis? Like a SWAT team's going to come in and invade us. And it's just really unfortunate that it's not taught what's going to overcome the stigma. The stigma is being overcome. I mean, we're slowly winning the battle because more people are getting lived experience with medical cannabis and more states are legalizing it. 93% of Americans support the legal access of medical cannabis. The VA is just really behind because they're just more subject to the government's rules and restrictions. They're sort of in a bubble, but I think that's going to change as like the rest of society's perceptions and beliefs, they can't really insulate themselves from that forever. I have a friend who's a doctor at the VA and, they just drug test people. And it makes it really hard for the doctors and nurses to use cannabis, for example. One of his nurses got called the other day and they're like, report to occupational health right away. And she's like, why? I'm healthy. And they did a drug test. And like, there's just no reason for that. Why are they drug testing people for no reason? It just creates a culture where people are afraid to use it, afraid to recommend it. So I think we need to just pressure them on all levels. The last point I want to make is that, doctors have been on the wrong side of the war on drugs for the last like 40, 50 years. The reason cannabis is becoming legalized is because patients got it right and doctors were sort of forced to follow along. It's being legalized because of patient pressure. And then doctors are sort of being frog marched into agreeing or going along with it. And I think that's sort of what's going to happen with the VA. I think there's just going to be a lot of pressure from citizens and from veterans, and then the administration is going to finally have to go along with it. And that's sort of the dynamic that we're seeing.
Thank you. So you just heard from 3 physicians, ladies and gentlemen, and as we see, it's notated by these doctors that yes, we all have an endocannabinoid system and it regulates our body, but we also know that there is a huge stigma and this plant surrounding this plant. And as Dr. Rachel said, it goes back to the war on drugs. So Dr. Rachel, I'm a veteran, and let's just say I don't know anything about medical cannabis. You're a physician and I'm in your area. I come into your clinic and I say, Doc, I was deployed a few times. I've got some back injuries, some hip injuries. So Dr. Knox, how could medical cannabis potentially improve my quality of life?
That is a loaded question because cannabis provides, that's a pretty loaded answer. Dr. Paloma hit the nail on the head, right? Cannabis, the plant is a treasure trove of phytochemicals. We call it a polypharmaceutical. It's full of cannabinoids, phytocannabinoids, right? Phyto meaning derived from a plant. So plant-based cannabinoids and terpenes and, oh gosh, almost 400 other phytochemicals that are creating something that we call an entourage effect, where all of these phytochemicals are working together to create an outcome that is more appreciable, right? More effective, more efficacious than any one of those molecules has the potential to create alone, right? So that's one, pro when we compare it to a monomolecular drug, like a single molecule drug that most of us are familiar with as we get drugs prescribed to us for one reason or another. The most common reason consumers of all kinds choose cannabis is to treat chronic pain. What's really interesting about cannabinoids are that they can bind also to our opioid receptors to create something called synergistic analgesia, meaning, right, that when you use cannabis with opiates, we are effectively treating pain more adequately with lower doses of either. So if you're coming into the clinic to consider cannabis for chronic pain, and really cannabis is more effective in treating chronic pain as opposed to acute pain. Like if you bump your elbow against the wall, yeah, cannabis might not be so effective, but things like chronic back pain and chronic aches and pains from arthritis are very commonly and well treated by cannabis. But that's not the only thing cannabis can treat. And I think it's important to go back to what I described as endocannabinoid deficiency syndromes, right? PTSD being one of those that is a true anandamide deficiency, right? Now, when you think of deficiencies, I like to use a vitamin D as an example. When you have a vitamin D deficiency, what do we reach for to treat it? Supplemental vitamin D. Well, guess what? THC is analogous to anandamide, right? So when we have an anandamide deficiency, it actually becomes clinically appropriate to use THC to supplement those low anandamide levels, right? They're almost a one-to-one, almost. That's probably the best way I can describe it. So in my early days, caring for veterans with PTSD, I was learning from them that they did much better with products that had some THC in it. And the physiology of the endocannabinoid system, the pathophysiology of PTSD teaches us clinicians why. It teaches us why we should be recommending certain chemical profiles, in this case, some THC, to people suffering from PTSD. And the same goes for chronic pain, right? Depending on whatever condition you have, it is our job as physicians to understand how to appropriately apply the science of cannabis, right? Choosing whether you'll benefit from CBD or THC or CBG or CBN for whatever reason, maybe insomnia, so that we can advance what we're actually calling cannabis-derived precision medicine, which is really wild in this space. But yeah, in our clinics, we see a lot of vets, and unfortunately, they come to us because their VA doctors are not properly equipped to even hold an intelligent conversation with them. It's one thing to not be able to write an authorization, right? A lot of physicians are dealing with the institutional stigma that Peter described as well. But where we're getting it wrong is through censoring our doctors from having intelligent conversations with our patients who are looking for alternatives. And that's probably harm reduction 101, right? Educating the first line health and medical professionals so that at minimum, they can understand the pharmacology of this plant. So these things don't do things like drug interactions, right? I think that's what I'll end on right there. When it comes to our vets who might have laundry lists of prescription drugs, it's also our job to reconcile those lists and help make decisions about what products to use, how to wean off pharmaceutical drugs if necessary. And yeah, those are all the things that our veterans should be able to expect from competent physicians when they want to learn more about using cannabis for any of their medical problems, not just chronic pain.
Thank you so much. So for my guys and my ladies listening and everyone who may be watching with a family member, what these physicians are telling us is that cannabis may not be the end all be all for your condition, but it could be a very valuable tool in the toolbox of your health. So this leads into my next question. I'm going to start with Dr. Lehfeldt. Doctor, I know that physicians are not writing recommendations for patients to obtain medical cannabis through the VA. So with that being said, Dr. Paloma, what is one of the ways that we can be effective at potentially educating physicians that are working in the VA healthcare system?
Sure, it's all physicians that need to really be educated here. Again, it all goes back to the reason that why we aren't taught about this in medical school, and it's completely doing patients and veterans a disservice. Cannabis is currently Schedule I drug, meaning it has absolutely no medical benefit. It's in the same category as methamphetamines, while oral opiates are in Schedule II, which kill 113 Americans every day. Going back to your question on stigma, there's absolutely no stigma for chronic pain, which is an epidemic in our country for a patient, for a veteran to go to CVS, get their $6 bottle of opiates and go home and treat their pain. Yet going to a cannabis dispensary has a completely different experience, and people pigeonhole these people that are really trying to treat their debilitating diseases as hippies or having drug-seeking behavior, and that's completely unacceptable. So at this point, you really have to go back. We can't just be physicians. We have to be historians. We have to be activists. We really have to understand why it is that we aren't learning about phytocannabinoids, cannabis-based medicine, and the physiology of our endocannabinoid system. It's able to really benefit so many different conditions. And it's absolutely inane, the fact that we have veterans who have served our country and we aren't able to give back to them. We're giving them, as Dr. Rachel said, single agent pharmaceuticals. We're giving them opiates. We're giving them SSRIs, which increases suicidality, which veterans are already predisposed to, when we have an alternative or sometimes an adjunct therapy for these conditions for our veterans. So again, bringing it all the way back to why aren't we taught about this? Why is this a Schedule I drug? And it's because of completely antiquated, xenophobic, and racist legislation that's been unfortunately a part of our country's DNA and has really been affecting our veterans and other communities since 1937.
Wow, thank you so much. So now we know that we do have an ECS, which is the endocannabinoid system. We've learned that it may potentially help with signs and symptoms of PTSD, chronic pain, insomnia, maybe even gastrointestinal problems. Well, here's a question. I know that many veterans, their only experience may have been with smoking cannabis prior to joining the military. Dr. Grinspoon, are there other ways for veterans and patients to consume it who may not want to smoke or who may have conditions that prevent them from smoking? What are some other ways that patients can potentially use some of these products for therapy?
Well, these days there are tons of ways to consume cannabis. Some people like to smoke because it's like a ritual. And, smoking isn't the healthiest way to consume cannabis. Now, cannabis smoking has never been definitively associated with lung cancer or COPD, but it does cause like a chronic bronchitis. And I recommend to people that if they're going to take it inhalationally, that they vaporize a dry flower, because you don't really have to incinerate it to get the cannabinoids. You don't have to heat it up that high. And that's much better for your lungs. And some people do need to inhale it because it gives you like immediate symptom relief, whereas the other ways of consuming it aren't quite as rapid. But people can certainly use a tincture, like an old-fashioned cannabis dissolved in alcohol or in some kind of fatty solution, and put it under the tongue. It's not as quick as smoking. It takes maybe 20, 30 minutes to kick in, and it lasts like for 3 or 4 hours. Or you can do an edible. People take gummies, candy bars. You could take a pill. Gummies, the disadvantage is that it's a little bit hard to get the dosing right, because it takes an hour and a half to kick in. And people can sometimes make the classic mistake of like, they take a piece of chocolate, nothing happens in half an hour, then they're like, oh, this isn't working. Then they take 3 more pieces and they get way too high and have a bad experience. So you don't want to do that, because it can really take an hour and a half to kick in. The advantage of an edible is that it lasts for like 8 hours. So if you have like chronic pain or chronic anxiety, it can give you long lasting relief, which is really nice. So what some people do, for example, if they have chronic pain, is they'll take 1 dose of gummies or chocolate to take the edge off the chronic pain. And then if they have a flare up, they could take a puff off their vaporizer to kind of knock down the flare up. So the combination of like, think of it as a long acting pain medication and then short acting to take the edge off any flare up. Finally, there are topicals. For some conditions, like a muscle ache, a topical that you rub on can be really effective. If it's a deep pain, like a nerve pain or a sciatica, a topical doesn't often penetrate that deeply. But for some type of conditions, or if you have like an itching condition, a topical can be really, really effective. Now, these days, there are many more delivery systems, some of which are more experimental than others, but we actually have suppositories. Yes, cannabis is a medicine and there are suppositories. I know that doesn't sound like that much fun. There are inhalers, there are skin patches, and the science of, as Rachel would say, endocannabinoid medicine is advancing so quickly that who knows what we're going to have in 5 years. It's such an exciting time to be involved with this. So this is just what we have now. You know, stay tuned. We'll have probably 10 more delivery systems in a couple of years.
Thank you so much, Dr. Grinspoon, because I'm sure there are going to be viewers who see this who thought the only way to consume cannabis was to roll a joint like they saw back in the day on Cheech and Chong and smoke it. So for everyone who's watching this, what Dr. Grinspoon is elaborating is that you can potentially smoke it. It can be vaporized. It can be consumed via drops. They have topical creams, ointments, and even transdermal patches. He alluded to something that is a very important treatment regimen in my daily health. I use suppositories, and I know that there are a lot of people that suppositories do not qualify for them. It is not something that they even remotely would consider. Well, there is a separate demographic of patients that have internal pain, gastrointestinal disease processes, and upon getting over the stigma of inserting a suppository, I think that it would be a very strong treatment option for many veterans. So everyone, please keep, when it's come to taking these products, keep your mind open. I know you're going to stores, you're seeing creams and CBD, but always remember, not all products are created equal. Dr. Rachel, I wanted to come back to you because you are in a state that has had medical programs and they're a little bit more advanced than some of the Eastern or even Southern states. So Dr. Rachel, I'm a veteran. I suffer from chronic deteriorating disc disease and irritable bowel syndrome, and I have osteoarthritis. And let's just say I have a traumatic brain injury from deployment. I come to your doctor's office. Hey, I heard that I can get a recommendation. I heard that we have a medical program. So if I'm in a state that has a medical program, Dr. Rachel, what would be the steps in going about learning to obtain? How do I even get into a program?
Well, all states with medical programs should have a website that provides all of us the steps, right, step by step to obtaining a medical authorization, right? Some states have medical registries, some don't, or these medical registries are very loose, like in California, where you have the option to join the registry. But essentially, right, you'll either want to go to your primary doctor if they are willing to evaluate you for an authorization, or you might have to find a physician who advertises that they will. And when that happens, you will typically have to pay a fee to see that physician. And these days, it's still typically cash or out of pocket. Here in Oregon, we do have a discount for veterans. It's $20 to register to get your card. So what you do, you come in to see the doctor will evaluate you. Stanley, you gave me a textbook example, right? Clinical case for someone who, of course, would qualify. Every single one of those conditions are included on Oregon's qualifying condition list. Many states have such a list, right, where they detail the exact conditions for which they are willing to allow you to use cannabis. There are states like California who put the who give agency back to the doctor and say, doctor, you're competent enough that for whatever condition that you think your patient might benefit from cannabis, you can write that authorization. But alas, even Oregon is still behind the 8 ball with that respect. But anyways, you'd come in and get your evaluation and a doctor would just simply say, yep, you have conditions that qualify your use of cannabis for medical purposes. It is also an attestation that that doctor has discussed with you the benefits and risks of using cannabis as medicine. Many states, I think, like Oregon, require that doctors consider and formulate some sort of plan for the patient. And once you have that authorization, you can submit that authorization along with other paperwork. Typically, they want to have your government issued ID. Sometimes they'll also want the short form of the evaluation just to demonstrate that, yes, you've seen someone who is willing to help manage you along your use and your care. You submit that to the state registry, as we do in Oregon, and then now we've automated it, right? We finally caught up to 2021, where our patients will receive almost instantaneously either a temporary or permanent card that they can then take into a dispensary to reap some of the benefits of being a medical registrant. So in our state, the card waives taxes, so you get to purchase your cannabis tax-free. You can purchase more, right? You can purchase higher concentrations. And what else do we offer? That might be it. No. We're in Oregon, so we have home growing. So if you are a registered medical patient, you can grow 6 plants. The average adult here in Oregon can grow 4, so you can grow 2 more, unless you live in a a rural area where you can grow up to 12 plants. So I don't think we're going to get to that, but that's really important for folks who have difficulty affording the cannabis, right, in their jurisdiction. Home growing becomes really important. For one, touching that plant, right, nurturing that plant is therapeutic in and of itself. Home growing allows for 1 or 2, cultivating a relationship with this plant. And then 3, right, affordable medicine. Affordable medicine. I like to say that home growing is the most economical way to procure your medicine. And there are states coming online where you have to be a medical patient to grow any plants. But I think that's probably the #1 benefit.
Thank you so much. This has been some great information today. Ladies and gentlemen, please, I hope you're taking notes. I hope you be sure to follow all the speakers, because this is very important, and that ties directly into the AMVETS Alternative Healthcare Summit. Because in the world of advocacy and veterans, there haven't been a lot of organizations that have supported veterans in the usage of medical cannabis. And I am proud that AMVETS has come out and stated their place in regards to how they feel about it. And Dr. Knox, so we're going to tie into one of the last comments you just said. So guys, she said that they have a lot of products, you can grow it yourself. Dr. Knox has really alluded to the fact that Oregon is different than other states, where you are may be different. So please educate yourself on your state. And for veterans, the #1 question that I get when educating is, will it affect my benefits? Will I lose my military benefits? Most veterans that refuse to use it, well, they're afraid, because they're afraid of losing their benefits. And the way the benefits are set up, I am in the VA healthcare system. They're 2 separate departments. So one of the reasons that cannabis is very taboo inside the VA and a lot of other jurisdictions as well is because of lack of research. Dr. Paloma, what are your thoughts on veterans research and research for cannabis? And should there be more research done at the VA as we get ready to wrap up?
We should have a whole panel on this. I mean, it's unacceptable that we aren't able to perform good quality research. Again, the Schedule I status of cannabis disallows us from performing randomized controlled trials, which are the gold standard. As physicians, we're taught to practice evidence-based medicine, which is stepwise algorithm steps to treat conditions. If you have high blood pressure, you know exactly what the go-to medication is for it. And that isn't available for cannabis because the DEA has only released 1 research license at Ole Miss. That's changing now with the Biden administration. But unfortunately, Biden is trying to reschedule to Schedule II, which would still disallow for research. So it is unacceptable that we're in 2021. And we know, as Dr. Rachel alluded to, we know that PTSD has a physiological effect of a decreased anandamide. So we know that cannabis is able to treat PTSD, which affects 30% of United States veterans. So again, not being able to perform research is unacceptable and doing a disservice to everybody, including our veterans, including our physicians, which is what leads to the stigma. Even when we talk about cannabis, a lot of times when I talk to my former colleagues from medical school, they giggle about it because, again, we don't have that clinical research to back it up. So unfortunately, a lot of times we're pigeonholed into talking about case studies or a friend of a friend that we see benefit from medical cannabis, when in fact we look at studies from Israel over 20 years ago showing with randomized controlled trials that cannabis is really able to benefit chronic pain patients, to benefit PTSD patients. So again, until we deschedule cannabis completely, it's going to be virtually impossible to perform this research. It takes money, it takes time, and it takes people really signing up and being on board, scientists and physicians alike. So it's really amazing that AMVETS is providing this platform where we can openly talk about it, having fellow physicians being able to talk about it in a really amazing scientific way to show that no, there shouldn't be stigma. Yes, this helps for a variety of people, from pediatric patients to geriatric patients to veterans, for mental health conditions, for chronic pain conditions, for cancer-related chemotherapy and nausea. When we have a synthetic THC that's available for veterans to be prescribed today, Marinol, which is a Schedule 3. So again, that juxtaposition is incredibly disparaging for physicians that really know the benefits of medical cannabis and cannabis alike. So again, bringing it back into every physician's toolkit via RCTs and via destigmatization is something we should have done 100 years ago.
And Stanley, can I quickly just dovetail?
Absolutely.
Because we have to say this every single time, just to put what Dr. Paloma said in perspective. In 1999, our federal government, through the Department of Health and Human Services, applied for a patent on cannabinoids as antioxidants and neuroprotectants for the treatment, right, of ischemic diseases. What is that? Stroke, heart attack. For neurodegenerative diseases, right? Alzheimer's, Parkinson's, CTE. I mean, the list goes on. And this was awarded in 2003. It is 2021, folks. Our government has a patent on cannabinoids for medical purposes. Yet and still, cannabis remains a Schedule I drug. Yet and still, we're fighting to advance research that doesn't just study the deleterious effects, supposedly, of cannabis. And so we have to have these conversations. We have to begin calling out the hypocrisies that are hiding in plain sight. And that's why it's really unfortunate that our medical institutions like the AMA, really ironically, right, because they opposed prohibition, back in 1937, continue to perpetuate stigma. Right, their effort in overturning the medical cannabis bill in Mississippi, right, in the context of the government's patent, in the context of everything else Dr. Paloma prescribed, is not just concerning. I mean, I think it's criminal, personally, because yeah, it's doing everyone a disservice, not the least of which are our veterans, to whom we owe so much. Right. I like to say that this war on drugs, right, this war on people has caused intergenerational trauma, intergenerational disparity in our country. And it's those who have been most disinvested in, like our veterans, who really should be the first to benefit. And I know we need more research, but I also always like to say this: we have enough research today, right now, to create sensible, reasonable, and safe frameworks for legal cannabis. We have enough information right now to begin educating medical students and nursing students on the endogenous cannabinoid system, to require minimums, continuing education for those of us who are already in practice. I had to take 12 hours of a mandatory an opiate, right, CME to maintain my California license. In states that have legalized, where adults of any background can access cannabis legally, it is our due diligence, right, to know minimal amount about the physiology, to know a minimal amount about the pharmacology. Nobody, doctors, you don't have to know this information to the degree that we do, but when someone shows up in your ED or in your primary care clinic and they acknowledge that they consume cannabis and they're there for a particular reason, you got to understand without bias, right, how to manage that patient, let's take a non-primary care perspective, for example. My mom's an anesthesiologist, right? She's one of the doctors in our clinic. And she says all the time that, for whatever reason you use cannabis, that means less to her than knowing how she might have to adjust, right, her anesthetics when you come in for surgery. And this medication reconciliation has to happen all the time. It doesn't matter what you take. We have to do it with anything that you might be prescribed or might be consuming. That's our job. And quite frankly, there's something called the sin of omission, meaning that doctors can be sued for not giving you information, right, that might have been helpful or protective, right? So in my opinion, our state governments, our licensing boards, our hospital and healthcare systems are setting us up to do more harm, right? And I don't know, we all took the same oath, right? First, do no harm. It is our job to properly counsel patients on anything under the sun. So really, this nonsense just has to stop. It has to stop, not just for our benefit or for our patients' benefit, for ours too. We cannot be good doctors when we're censored. We cannot be good doctors if we are fearing for our licenses and for our employ, right? And that trickles down to the care of the patient. And so if we really care about harm reduction, if we really care about the well-being of our patients, we're going to lift the censorship. We're going to allow our VA doctors to have intelligent conversations with their patients to discuss both benefit and risk of cannabis, because that's what our patients deserve. That's what our veterans deserve.
Dr. Rachel, I know that this conversation is going to help a lot of people, but I want you to know that you just hit home with me. I'm actually fighting back tears to hear you, Dr. Paloma, Dr. Grinspoon, because I fought a long battle with the VA. There were times where they offered me opioids or tricyclic antidepressants and things of that nature, and I would not take them, and I would tell them, hey, I'm taking a 1-to-1 tincture. Hey, I'm taking a 3-to-1 CBD tincture. And with my personal experience, I was inserted into a substance abuse treatment program because the physicians did not know. So for veterans who may be watching this, once you start to dialogue about medical cannabis or admit to medical cannabis usage, there are times where your physicians may not like that. And as a punitive reaction, they may enter you into what is known as SATP, and it is the military, the VA Substance Abuse Treatment Program. I was actually inserted into this program last year after being hospitalized and not wanting to take Dilaudid, fentanyl, and tricyclic antidepressants. They deemed me a non-compliant patient and stated that no normal person would not want to take drugs and take some drops instead. So thank you so much, Dr. Rachel. And we're going to get ready to start wrapping up here, but I do have a lasting question that I want everyone to give me like a good 30-second answer to, because I know the veterans have absorbed a lot of information today, and we want to make sure that these sponges are full before we leave. So what are some ways that us as advocates, clinicians, physicians, researchers, what are some ways that we may be able to help the general public and physicians and caregivers on medical cannabis and veteran support? I'll start with you, Dr. Paloma.
Sure. I am outside of DC and I am lobbying every day I possibly can. Do not be scared to talk about cannabis. It is not a bad word. It should never have been a bad word. And we're going to bring it back into every single physician, healthcare practitioner's toolkit. Our veterans served us. It's really time we give back to them. The people that would really benefit from medical cannabis are the ones that aren't able to access it. And again, it's completely unacceptable, for lack of a better term. And it, like Dr. Rachel said, it's criminal.
Thank you so much. Dr. Peter Grinspoon, as we leave here today and the attendees, what are some things that they can take away to help them to educate others and the general public in regards to supporting veterans and their usage of medical cannabis as a treatment option?
Well, as they say, sunlight is the best disinfectant. And the best antidote to stigma is for people to have open and honest discussions. So educate yourself about cannabis as much as you can. Talk about your experiences, good, bad, and ugly, about cannabis and about opiates and about other drugs. Communicate with people, join support groups. have high expectations for your doctors. Just speak to your doctors to say whether, just say, I am interested in discussing medical cannabis. Expect that they know about it, and, bring them papers, and just have high expectations for them, and don't take no for an answer, because it's just part of what they need to know and are responsible for. Now, you have to factor in that they're under pressure from, the institution of the VA not to know about it. But at the same time, they have a much deeper obligation and responsibility to their patients with the Hippocratic Oath, as Dr. Rachel was talking about. So really have high expectations, educate yourself, fight the stigma, and things are changing, but we need them to change faster. So if we keep doing what we're doing, we're going to get there.
Thank you so much. And finally, Dr. Rachel, I know you and I have sat on some other discussions with some researchers as well. What are some of the ways that we can really be impactful as we leave with this information? And how can we continue to support veterans for medical cannabis, and to really, as you stated earlier, have a non-biased, non-judgmental approach to look at those veterans? So how can we help them and be more impactful?
Yeah, as a functional medicine doc, I'm always looking for the root cause. And in this instance, and Dr. Grinspoon and I serve on the board of Doctors for Cannabis Regulation. And that's what it's going to take. It's going to take all of us, all of us healthcare providers, to say, no, institutionally, some things have to change here. Right. So right now we're starting to talk about federalism, right? Legalizing at a national level. We are going to have to carve out benefits to our veterans. I mean, we're going to have to call it out, carve it out, codify it so that we ensure that we are serving our veterans. If we don't by name call out who's most disinvested, we're never going to invest in them. We're just never going to get around to it. So we're going to be very intentional about directing licensing boards for nurses and doctors and everyone in between to loosen up some of their restrictions, all of their restrictions, to encourage or make, requirement, right? Require a minimal amount of education for these health and medical providers, like I said, because until we reverse the stigma within the healthcare system, we're not going to get very far, right? But when it comes to us health and medical professionals, we started with anatomy, then physiology, then pharmacology, right? So we have to start with the endogenous cannabinoid system. We have to teach our health and medical professionals about the ECS. You don't even have to use cannabis, right? There are other botanicals that work on this system as well, right? It's the physiology that we need to be expert in. Yes, we need more funding for research, and that can be requested at the federal and at the state level, right? We can direct cannabis tax revenue to serve veterans, to serve research. And directing medical schools to include this information, right, in the common curricula, right? All of these things, unfortunately, in my opinion, are going to have to be defined in statute in order for people to change their ways. I just don't see it any other way. So as those of us who are politically active and advising policy and regulation, we're going to have to go right to the Capitol Hills or right down to the regulatory office to make our cases. Right? We are our best advocates, health and medical professionals, but we're also advocates for patients. And I like to always say we have to fill up to pour out. So we have to fix these institutions so that we can do the work that is supportive to our patients.
Absolutely. Thank you so much. I know Dr. Grinspoon had one more point to make. Ladies and gentlemen, I know you're hearing these physicians telling you these points, but I don't want you to think that these points are only from a doctor's standpoint. I am not a doctor. I am not a practicing physician, although I did stay on holiday in Select last night. But we have to be our own advocates. I had to insert myself, go down to the Capitol and talk to our legislators. And I told them, not only have I earned the right to alternative therapies, as a veteran, I deserve it. As a service member who served my country. We're going to wrap up, get ready to closing remarks. But before we do, Dr. Peter Grinspoon, you want to make one last remark?
Well, yeah, just that I wear two hats. I'm a general primary care doctor and a cannabis clinician, and they sort of are starting to converge. And I just want to say, like, my life is so much easier that I use medical cannabis, and the other doctors don't have this option. And I think the veteran doctors are going to be so much happier, in addition to the patients being happier once they can prescribe medical cannabis. I think everybody's going to be better off. It's not just the vets that are going to be better off. The whole system's going to be better off, because from the doctor's point of view, they're going to have a much better option for chronic pain, for insomnia, for anxiety, for PTSD. So it's going to be better for everybody, not just for the patients. I think the doctors are sort of being held hostage, and the nurses. I think everybody in the veteran system is being held hostage by this policy. And I think it's going to be so much better off for everybody. And it's going to result in a much better doctor-patient relationship once you get over this stranglehold they have on talking about and recommending medical cannabis. So I think it doesn't just affect the veterans, it affects them directly, but it also affects them indirectly, because it's going to be healthier for everybody once we get rid of this. So I just think it's so crucial that we get rid of this prohibition in the VA hospital, because there's just so much potential to help veterans. And you see in other systems where it's opened up, the doctors have so many more tools to help patients. It's really astounding.
Thank you so much, Dr. Grinspoon. And I want to thank everyone who's attending, everyone that's watching, everyone that's also going to share this video. I want to thank my panelists. And most of all, I want to thank AMVETS. When I heard about this summit, it hit me immediately. I had to know who was on it, who was doing it, because I knew that I want to be a part of it. And you too can support the AMVETS organization. They are doing some great work. And thanks to the AMVETS organization, they brought us this today. So as we close, we'll start with Dr. Paloma. Please tell everyone how they can get in touch with you and how they can stay tuned to what you're doing.
Sure. Again, Stanley, thank you so much for an amazing panel. Dr. Rachel, Dr. Peter. I mean, I had so much fun. I could do this again and again and again. Again, the importance of educating. This is the only plant, the only medicine where the patients really know more than their physicians about the plant, because they see that it's benefiting them. So continue to do so, continue to speak up on the Hill, go lobby, talk to your physician. If you can follow me on Instagram, I post medical journal articles. You can print them out, show them to your physician, your naysayer friends. It's _Dr_Paloma. And you can visit us at www.vireohealth.com. We currently have 2 clinical trials on chronic pain. We have many veteran participants and really trying to bridge that gap between research and cannabis. So again, we can destigmatize, deschedule, educate, and advocate for this plant. Thank you.
Thank you. Dr. Peter Grinspoon, how can we find you and how can attendees follow up with you to keep abreast of what you're working on in this industry?
Absolutely. Well, first of all, I want to echo, thank you so much for having me. I wish this panel were like, where'd the hour go? This was so fun. I'm on Twitter a lot, Peter_Grinspoon, just my first name and my last name. And also people can ask me questions. I also do certify veterans in Massachusetts at petergrinspoon.com. And again, thank you for having me. This was such a great experience. And I look forward to carrying on this as an ongoing conversation in the future.
Thank you. And Dr. Rachel Knox, you gave us a wealth of amazing information today. Please tell us how attendees and viewers can follow you and your team's work on what you're doing in Oregon as well as abroad.
Absolutely. So, I'm one of 4 Doctors Knox, and our website is doctorsknox.com. From there, you can access our clinical website, American Cannabinoid Clinics, also www.theacclinics.com. What else can I tell you? So within the past year, several colleagues in the space and I founded a movement, the Cannabis Health Equity Movement. And this is a movement to demonstrate that cannabis is a root solution to addressing not just medical problems, but socio-ecological problems that are at the root of disparity, of health disparity, of prosperity disparity in the United States and abroad. We like to talk about the 50,000 uses, right? Innovations of cannabis across agriculture, industry, nutrition, and medicine. And our movement is being led by our BIPOC Medical Association, which is the Association of Cannabis, Health, Equity, and Medicine. And again, I mentioned disinvested in communities, the VETS being one of them. But we believe that we have to start demonstrating the possibilities in the communities most disinvested in, so that we ensure that all people can benefit. So yeah, and you can learn more about that movement at achem.org. That's achem, ACHEMED.org. And the Chem movement at large at Chem Alliance with a Y, because we recognize that we need allyship in this space to make it move, chemalliance.org as well. And thank you so much, AMVETS, for having me. I echo what everyone else has said. This has been a phenomenal panel. We could do this all day long. Many of us do this all day long, every day. Yeah, so glad to be here, and really hope that we did impart some wisdom on all those who are watching.
I forgot to mention Doctors for Cannabis Regulation is the group that Rachel and I are board members on. DFCR.org is a spectacular organization where we're both working on legalization across the country, because there are a lot of places where it's flat out illegal. In some parts of the country, you make $1 million for selling cannabis, and in other parts of the country, you go to prison for selling the same cannabis. So we're working on that. And it's also, we're working very hard to educate the healthcare professionals that we've been complaining about, don't know anything about cannabis. So DFCR.org is a wonderful group that Dr. Rachel and I are both board members of. So.
Thank you for that as well. And please, everyone, be sure to follow the AMVETS platform. Be sure to join their mailing list. If you want additional information, how you can support veterans or how you can support the AMVETS organization, be sure to follow AMVETS, and don't be afraid to volunteer, donate, or even just spread the word. So we've had a great panel with some amazing doctors. Again, I am your moderator, Stanley Atkins II. I'm known as the Cannamedic. I am the acting Georgia chapter director of Minorities for Medical Marijuana. I am a sitting board member for Cannabis Patient Care magazine out of Boston. And I'm also a board member for the Georgia Medical Cannabis Society. You can stay in touch with me on all social media platforms. I'm at the Cannamedic, and that is spelled CANNIMEDIC. So for everyone in attendance, friends, family, I want to say thank you for your service. Thank you for commending and attending with us today. And I want to thank you AMVETS for this amazing opportunity. Thank you to Dr. Paloma Lehfeldt, Dr. Peter Grinspoon, and Dr. Rachel Knox. I would also like to acknowledge Charissa Jackson from the AMVETS organization for making all of this possible. Thank you, Charissa, for all that you do for veterans. And everyone, please stay tuned, because AMVETS has plenty more information in the future. This is Stanley Atkins II signing off from the AMVETS Alternative Healthcare Summit.